it's good to see you, Ms. Peterhouse. We're just going to go through your history with your multiple sclerosis carefully as we're trying to make decisions about what
Sure.
we're going to do next for
Okay.
you. And I know you had had quite a problem with your headaches before you really developed other neurological symptoms.
Right.
And my understanding was you actually ended up in the hospital with a headache, but you weren't walking well.
Right.
And that was really the first thing that was really out of the order for how your headaches had always been. And they did MRI scans back about 4 or 5 years ago, and they just couldn't see anything different. And
Right.
we looked at those, and I looked through those today, and other than that your brain looks a little older than you are, is really nothing to see on the brain scan of the head. But it became clear that you were not walking well, and there was a lot of other things. Can you tell me about what you were feeling back at that time? Because you had a lot of problems happen at once.
I did. I was struggling to walk. I had my right leg would, what they say, drop foot. I kind of drag my toe. It would go out from underneath me. I would fall pretty frequently. I was having issues with my bladder. Either it was retention or I couldn't control it. I would struggle getting my thoughts together. Communication was an issue in my job that I was working. Remembering dates and times and patients' names was critical, and I struggled. I couldn't do it. I was having trouble bathing. I had to have help with bathing because it was like my right arm was just very weak and my leg was weak. And so I saw a doctor locally, and they did an MRI and sent me directly to you. Recommended that I stay on the walker until I could get, hopefully get back on my feet, and we've been able to do that. So.
Well, and so really, I think I started seeing you around 2016, and you were not walking well at that time.
Yeah.
And
I wasn't able to drive. It was a bad time.
you're unusual in the sense that with MS, is most people with MS have pretty obvious changes on a brain scan, but what you had was problems with your brain function without obvious changes, which does happen, but it's not as frequent, and it makes us a little bit more leery about whether it's a different illness than MS.
Right.
And in this case, it responded some to treatment for MS. Do you remember, because the first treatment I believe you went on was interferon beta. It was called Rebif.
Right.
And that was back in 2017.
Right.
Can you tell us about your experience with that?
I did okay with Rebif. I really didn't notice a change so much in my activity level. One of the side effects is, a deep depression, and I did sink into a pretty dark depression, and that's when we talked about, making a change from there because of that. And of course, with MS, depression is pretty prevalent because your life has changed dramatically overnight, so to speak.
Yes.
And so
when you first came to see us, you were weak on one side, you were numb on the other side, both your legs were stiff. You were not walking well.
Right.
You were wearing braces to keep your ankles there. You were using a walker a lot of the time. And we gave you, when we first saw you, we gave you what we call IV steroids, and this is methylprednisolone. It's an anti-inflammatory medicine. Can you tell me about your first experience with that, how you felt when you got those treatments?
It took, you said it could take up to 3 to 4 weeks for the steroids to really kick in. I did notice a difference in me physically feeling better. A little bit more energy, that sort of thing. I think my walking did get better. I think it wasn't a cure-all by no means. I was having home health physical therapy come, and I think a combination helped me kind of get some of my strength back that I had lost.
So let's kind of go back to your treatment history, because you spent really a very short time on Rebif, and you got depressed.
Right.
And a lot of people have fluish symptoms. Did you have fluish symptoms with that?
The first couple doses I did.
So it was the fluish symptoms weren't the big problem.
It was the depression.
Okay.
I struggle with depression. I have a history, and and I just did not want to get back to that dark place.
No,
So,
no, and that actually is an issue with that family of medicines.
Right.
So we changed you to a medicine that's actually known for its benefits
Right.
on mood, which is called Gilenya, that works very differently. And you had some difficulties with Gilenya as well. Can you tell us about those?
I was still struggled with walking. We went on a cruise, and I was using a scooter at that point because of the amount of walking and that sort of thing. I developed shingles on the cruise. You were kind enough to email me back and forth to get me through that. And, you said it probably wasn't related, but it could be. And, I came back later that summer and was still just we weren't seeing any improvement.
Yes.
And so
Yes.
that's when we decided to move forward with the Lemtrada.
Well, and so it wasn't very long, and it was very clear you were extraordinarily severe in that you were just walking a short distance with
Right.
great effort.
Lots
you
of
had
muscle
you had a lot of
spasticity.
sensory loss in your limbs. You didn't have good control of your bladder, and that's why we went to that. We went to Lemtrada for two reasons. One is because you were continuing to have relapses and on good treatment, and
Right.
these are not ineffective treatments you'd received.
Right.
And you had these spinal cord symptoms. Spinal cord lesions are generally a bad prognostic sign, and regardless. And so while it was responsive to steroids, you didn't get back to a better baseline. And so we looked at doing that. Lemtrada is an old medicine that's only been approved since about 2014 in the United States. But we had some experience for many years with it because it was available to us. And we went to that for hope of improving you, and not only controlling disease, but improving the disease.
Right.
And you got 5 days of that. Now it's about 2 years ago.
Right.
Can
And
you,
I did very well.
can you tell us about what, during the infusions,
during
what your
infusion,
experience was?
I struggled a little bit with some nausea and just altogether fluey, just not feeling well. I think I had a migraine one or two, one of the days into it. And then a couple weeks after, I still felt kind of fluey, and obviously it was flu season, so I was staying in away from people as much as I could. But that was in November. Come January, February, I noticed a vast improvement in my stability, in my walking, in my
So that was what, about 3 months?
3 months after.
And that's really, we consider that a very gratifying thing.
Right.
Tell us, because you had been using a walker and a power
braces,
wheelchair and just very limited in distance.
Right.
What changed and how did it change?
Like if we went to the grocery store, as long as I had like a grocery cart to hold on to, I could get our groceries. I slowly got back into driving because the vision improved quite a bit. I've got more control of my right leg, and that's where I was able to start driving again. That brought back a huge amount of independence. I felt so dependent, and being a 41-year-old woman with 2 children, it was very difficult. It was a difficult time, and I felt like I was getting my life back finally. There were struggles along the way. I think I had a relapse that summer, but responded well to the steroids and was able to bounce back. And
That's great. And then the second treatment course with Lemtrada was done about a year ago.
Right.
And tell us about that.
I did much better on that one. I didn't feel as bad. No related headaches or anything like that. Maybe once I got home, I felt a little run down, but of course, being away from home for 3 days and that sort of thing. I didn't notice any of the body aches and that sort of thing after the second round.
How has the second year been? With
I think it's
Lemtrada?
been very well. I mean, we were able to go, we like to travel, and we were able to go on a cruise in May. No leg braces, no scooter. I carried the walker just in case I needed it. I didn't use it. I'm able to walk distances, like I said, grocery shopping,
Mm-hmm.
that sort of thing. My son plays golf for a high school team. I'm
Mm-hmm.
able to, in the golf cart, follow and watch him play,
Wow.
even in the heat.
Okay.
And of course, I have a cooling vest and that sort of thing if I need it. But it's really brought back me. I've been
Okay.
able to be a mom again and do, and a housewife, and do the things that I need to do. There's days I don't feel well. We all have bad days. And there's days that I struggle. I still have a lot of spasticity in my legs. Physical therapy and aquatic therapy is helping a lot with that. And as long as I stay moving, I go to yoga a couple of times a week. I'm doing a lot on my own to
Great.
try to help that.
Great.
But I do, we had a couple bumps in the road with relapses this summer. I took some oral steroids several weeks ago, and I feel like they're kicking in about now.
How do you feel about having further treatment with Lemtrada?
I definitely have been open to it. I would love to have a year with no relapses.
Okay.
I mean, that would be fantastic.
Some people we can get there. Some
Yeah.
people we can't.
I
down to
understand.
one relapse a year is good for people who have this difficult a disease. But let me ask you. So Lemtrada has a lot of warnings
Right.
and potential things that can go wrong. Infections are one of them.
Right.
And did you have any infections or any problems with it?
Not, I don't think related to
Yeah,
that. I did have a small skin infection
Okay.
about a month ago. It was right after the steroids, so I don't know how much of
Did
that.
you have to go to the hospital for
I
it?
did.
Yeah.
I spent several days in the hospital.
Yeah, and that's
had to have some surgery to have it drained.
not unusual.
But it was right after the 3 days of prednisone, so
Yeah.
I don't know how much of that played into my immunity.
The prednisone was what caused it.
Yeah,
So let me ask you, how do you feel about because you have blood testing every month
Mm-hmm.
to watch for uncommon complications, which would be major thyroid problems
Right.
or bleeding disorders or even rare things.
Right.
How has that gone?
It's gone very well.
Okay.
My veins are not very good, so
Mm-hmm.
I have a life port, and I go to my family doctor once a month, and she takes care of it. And then when I come see you every 3 months, they take care of it here, and
Great.
it's really not any, issue at all.
So let me ask you about one other thing, because your
Sure.
bladder gave you a lot of
It
trouble.
has.
Is that still an issue?
Right now, it's doing very well.
Yeah.
During the relapse, I would either have severe retention and have to do some self-cath, or, like at night especially, I would have no control.
Okay.
There's no rhyme or reason. It's no, and there's really no medicine. You take one for one thing, and it makes the retention worse, and you take something for retention, it makes the incontinence
leaking.
worse. And so I just kind of learned to deal with it. It's hard, but
That's a wonderful explanation.
there's
of the
so many
problems.
things that are unseen with
Yeah.
this disease. If you
Yeah.
look at me, you think, well, she looks great. But, there's so many unseen things, the spasticity and the bladder issues and some of the cognition, memory of dates and times that I struggle with. But
Let's come back to the
Okay.
to the spasticity, because that was a big problem early on.
Right.
Tell us about what you mean by spasticity. How does it affect
my
you?
legs have been they're very stiff. They're my hamstring and my calves feel like they have Charlie horses in them. There for a while, it was waking me up 3 or 4 times a night with severe muscle spasms. In the mornings, I'm very stiff. I have to really work and get my legs working.
Do you stretch?
I do stretch.
Okay.
And then, like I said, I do yoga twice a week, and I've been going to physical therapy, and they really stretch me out very well, and then do the aquatic therapy. And then you did injections 3 months ago,
Yes.
and
How did that work? The injections in your legs.
I think it worked pretty well. I mean, right now I'm doing very well. I still have this stiffness in the mornings, or if I've walked, like if say I walk around a grocery store for a while, they'll kind of, okay, what are you doing? But I think it's worked pretty well.
let's talk about your thinking. I know you had to quit work at one point.
I did.
And
I hated that. I was a social worker in long-term care, and you either love long-term care or you don't. And I love it, and I love that generation. But in that job, you're stopped in the hallway. Hey, I need this. Hey, I want this, or different things. And I got where I couldn't remember patients' names and patient room numbers, and then of course the walking, was an issue. The fatigue was a huge issue. I couldn't make it through a day, and so I was able to take a short leave until I saw you, and you were just like, your disability is obvious. And I went ahead and applied and was approved and for disability, and so now I do like volunteer in long-term settings, like a couple hours a week, just doing visits, and it gives my heart something happy to do. And when all this started, I struggled with like remembering my own children's birthdays, my address, things that you should be able to just spit out. That's much better. I read a lot. I do a lot of puzzles, trying to keep my mind active. When all this started, as much as I love to read, I couldn't read because I would read a page, and then when I turned the page, I couldn't remember what I just read. And so nothing, in the book would make sense. And I'm back to where I can read,
So let me ask you, you had a very detailed neuropsychological evaluation a couple years ago with a PhD neuropsychologist.
Right.
Can you tell us about that experience?
Yeah, it was very interesting. It was an exhausting day, but he was great. I went in because I couldn't remember dates and those sort of things. My mother had early dementia, and that was my fear, was that, oh my goodness, I'm going to have. And so, he asked me in the beginning, what do you want out of this day? And I told him that was my fear. And at the end of the day, he said, you don't have dementia. You have some MS-related cognition issues. Do I think you can get some back? Maybe. But he did all kinds of tests throughout the day. It was very thorough. Very interesting, and I mean the reports very detailed, very interesting.
I have the report if you want to, if you'd like to go over it, and just
Sure.
let us know if there's something you don't want
Sure,
to talk
no
about
problem.
in it. So he did about 20 different tests with you, and which were really meant to look at all kinds of things. And he did everything from measure how hard you were trying to, if you knew where you
Hand-eye
were.
coordination, that sort of thing.
So the things that were interesting that were very related to MS is you had a harder time with working memory. I mean, these tests are done for people your age and education, and so they're they put you on a bell curve,
Right.
essentially, and anything that had to do with keeping track of things or speed, you were poor at.
Struggle.
And so your working memory, I mean, it's worse than 9 out of 10 people your age. Your ability to pay attention to details like numbers and things, worse than 95% of people your age.
And that really affected my job. I would have to redo reports. I would.
So when somebody talks to you, they say, "Oh, she's a lovely person.
Right.
There's nothing wrong," but basically, when we measure how fast you can do things and how reliably, it's like worse than an F. It's
Right,
a zero
it's terrible.
almost. Yeah.
And I've always been not necessarily OCD, but detail oriented. Everything has its place. And for my work to suddenly do a 180, and that with the combination of the physical issues, it was like, oh, something is.
Well, it's very interesting because he tested your memory quite in detail,
Right.
and the difficulties you had were quite illuminating, because if he did things like words where he knew you learned them, you were actually quite normal. But if he looked at things that were more complicated, like things you saw, things you heard, and looked at, then you were very poor. You performed worse than almost anybody. But if you learned something, once you learned it, you actually had it pretty good.
Had it, right.
Yeah, so this kind of problem we refer to as an attentional, an encoding problem, that is something that has to do with the ability of the brain just to process information rather than to actually remember it. Once you learn it, you knew it,
Right.
but you
How
couldn't
much
get
does
there.
that? I was diagnosed with ADD in high school, not necessarily the hyperactivity side, but the attention. How much do you think that?
It's hard to know because it's a fairly common problem.
Right.
ADD is a fairly common problem. We know from looking at your brain scan, your brain scan's not normal. It's different than other people. And we don't know if that's due to the MS or some other illness that you had early in life that
Gotcha.
affected it. And either one of those. The last thing that they did was to look at the speed with which you did things. And they had you do a test where you look at symbols, and you actually didn't do too badly on this test.
Good.
It was worse than 3 out of 4 people,
But,
but it wasn't too badly. And they had also you use some dexterity testing, and we'll
Right.
show that later. But with the peg holes where you would move pegs,
Right.
and your right hand was very, very poor. And
Right.
how did that affect you?
Of course, my right hand is my dominant. I'm right-handed. So obviously that would affect a lot with work, computer skills, driving, grooming, self-care. That affected quite a bit. I had to have help, in the shower and that sort of thing. My husband's thing was, I don't want you to fall. And I'm like, but I physically need your help because my hand would sometimes just fall. I love to cook. And it affected that dramatically, as well as the ability to follow direction. I would skip things.
Okay.
Recipes that I've known all my whole life that I don't even have to have a recipe for, I couldn't remember. And so that affected my emotionally because suddenly the thing that I love to do, I can't do.
You had trouble doing it.
Right.
Well, that's very helpful. And when it came to things, things like that reflect education and knowledge. You were actually pretty good. You could explain what Proverbs meant.
Right.
But you actually had a problem if he threw one at you didn't know. You actually had a problem figuring it out.
Get very frustrated.
Yeah. So if you hadn't heard it before, you didn't do it very well, and that is the thing. You also had some difficulties with when the rules changed in the game. You couldn't. It took you a while to figure it out.
To catch on.
Yeah. And so.
Yeah, I'm very much a creature of habit, always
Yeah.
have been. So if there's a hitch in the giddy up, so to speak, I get kind of anxious and nervous about that, and that's gotten worse in the last few years. So that makes perfect sense.
So thank you for letting us go through that
Yeah.
history. Guys, we're going to change now, and we're going to do exams, okay? All right. Hi. Can you show me your teeth? Yeah, stick your tongue out. Yeah, tilt your head back. Open your mouth wide. Say ah for me. Good. Can you hear my fingers on both sides?
It's louder on the left.
It's louder over there. Can you hear me whisper over? Yeah, okay. So it's a mild difference.
Right.
Yeah. All right, we're going to have you do a couple of things. I'm going to have you follow the light with your eyes, okay? Just follow the light way over here and way over here. Good. Way up here. Way up here. Good deal. I'm just going to turn off the light for a moment. Okay. And we're just going to shine a bright light in your eyes here. Good. And there. It's got a very minor afferent defect on that side. Yeah. And when you look at that red, is that red the same shade of red out of both eyes, or is it different?
It's brighter on the left.
It's brighter.
Yeah.
So kind of a
looks more-
less red or a
It looks
washed out red?
Kinda
How would you
washed
say
out, kind of washed out on the right.
on the
side.
right? Okay. Real good. We're going to take a look at a few other things, okay? Just let your arms go loose. Let them relax.
Yeah, easier said than done.
Yeah, that's okay. Just let everything relax. And you're a little jumpy. Your reflex is a little jumpy on this right side. And we're just... The hammer is more of a sensation tool, but it shows us if the reflex is disordered, which means it's a problem in the brain. And it's really how much the muscle pushes, not how much it moves. And I'm just going to test some reflexes in your feet. Okay. Are you on some medicine to help your reflexes? Some baclofen or tizanidine?
I take tizanidine
Yeah.
at night.
Yeah. So,
Yeah, the right side is.
I mean, they're both not normal, but the right one may be worse. So I'm just going to feel your legs with you sitting here for a moment, and they do resist a little bit when I do that. You can see it's hard to straighten your leg out. We'll do that again in a minute with you lying down, and we can feel just one little kick when we move that. Just want to test your strength now. Can you hold your fingers straight like a table? Don't let me push them down. Don't let me push. That right side's a little weaker than the left. Spread your fingers like a fan. Don't let me squeeze. Don't let me squeeze. Okay.
It's hard for me to focus on both hands at the same time.
Yeah, I know. That's why it's good. It's good for us. Squeeze really hard. Squeeze really hard. Yeah, so that, and now I want you to push me really hard with your hands. Push me hard. Push me hard. Just give me all you got just for a second. Good. Hold those hands far apart. Hold them far apart like that. This is an easier way to check the asymmetry of the muscular function. So, and those are the muscles I usually check with MS because they're the easiest ones to tell the difference. I would like you to lift your knee up in the air like this. Hold it up there. Look right at it. Hold real hard. Don't let me push. Yeah. And lift this one up, hold real hard. This is a pretty big difference. Now push your knees together, and those are very strong. Push them apart, those are very strong. Hold your heel back towards you, pull really hard, pull really hard. Yeah, it's just, you have a little bit of trouble also feeling it, I think. Hold your heel back towards you. Yeah. Point your toes out like a duck. So don't let me push. Concentrate. Looking at both. But they're pretty strong today. So one of the things that we have what we call giveaway weakness, which means people have a hard time sustaining an effort, that they don't feel it well, or it hurts, or something else gets in their way. But your legs are actually strong. Right arm just a hair off. We're going to look at a few other things with your sensation now.
Okay.
You can feel things just fine, right, between the two sides. Now, this is a way to test one kind of sensation. Can you feel it's cool? Do you feel the coolness of it?
It's cooler on the left.
Cooler on the left. How about in your face? Is that different between the two sides? Not really?
Can you do it again?
Yeah. It's just your first
Yeah.
impressions.
I would say the left is much cooler.
Okay, much
than the
cooler.
right.
So, and then we're just going to take a very light vibration. Can you feel that in your fingers or not?
I feel it on the left.
You
not
feel it
so
on the
much
left.
on
You
the
don't
right.
feel it on the right. If I make it stronger, can you feel it there in your finger?
I do feel that.
Is it still going?
No.
Yeah, but you can feel it over here. Okay. We're going to do that down here in your foot too. Can you feel it down there?
No.
Can you feel it humming? Not really. We're going to do it really strong. Can you feel it at your knee? Okay, good. Can you feel it there at your ankle? Not.
Yeah, not as strong.
Yeah,
but
okay. Now, can you feel it over here at all?
No.
No, not really. It's the same thing. You can feel it at the knee.
A little bit.
A little bit, yeah. All right. So that's vibration. That's one pathway. Now, this is a pin. It's a very sharp pin. Can you feel it sharp? Did it feel like a pin?
I don't feel it on that.
On that side?
Yeah.
You don't
my
feel
hand,
it?
My hand feels like my calf down feels like you've been to the dentist. It's just numb.
It's just numb. So that's a dull side, and that's a sharp side. Can you feel any difference? No. Over here, you feel that? That's
it's
sharp, and that's dull.
Yes.
Yeah. In your face here, does it feel sharp in your face? Yeah, good. Now we're just going to come down to your foot. You said it was a numbish down here.
Yeah.
Is it different between the two sides?
Not really.
Not really. It's kind of on both sides. It's
Yeah.
sort of off here. Does it get better up here, higher
Yes.
up your limb? This is something that we don't understand why it is with MS. It's very typical of nerve problems in the arms and legs, but people with MS have this same link-dependent issue, and we don't really understand why, but it's so common that we call it a false neuropathy because
Gotcha.
it's a pattern like there's something wrong with the nerves, but if we check them, if we do more careful tests, we know there's nothing wrong with the nerves. We
Gotcha.
can see they're fine. I'm going to have you do a few other coordination tests with me. We're going to have you hold your hands out like you're stopping traffic.
Okay.
Okay? Now point your fingers at each other like this. Yeah, you're very steady today. Now, can you
It's a
touch
good
me
one.
with your finger? Yeah, and touch your nose. Go back and
I
forth.
always struggle with this.
Yeah,
one.
well, you're doing it pretty good today. Yeah, and this one here, we're going to do it a different way in just a minute. Just a little bit of bobbling. I want you to hold your hands like this. Close your eyes now. This makes it a little harder to do. Touch your nose with that fingertip. Yeah, and just bobbles just a little bit, but very minimally. Yeah, good. Good deal. All right, that's lovely. All right, we're gonna have you lie down because I'm gonna examine your legs. It's easier to examine the stiffness when you stretch all the muscles. We got a good. You see, okay? Do you need to adjust?
You're gonna be doing the legs.
Yeah, we're gonna be looking at legs. I'm gonna be standing pretty close to her, so probably that you're gonna get your best views from these. All right. So when we were talking about spasticity means in neurology the resistance to passive movement. Okay,
Right.
there are reflexes that help you hold things still, and they get turned on too much, and the biggest muscles win. So the first thing we do is just move your leg, and one of the things we notice is your foot isn't floppy. All right, and that one's a little floppier. This is the one that's different. And so what I do is I just pick up the leg and just don't help me, just let go. And we first move it very gently through the range, and we feel when we go slowly, it moves pretty well. But then we try to move fast, and we see it fights us. It
Yes.
fights us. And
sore.
yeah. It may be that the muscle's there. The other thing we look at is the muscle that holds your leg together, and we can see it. It fights me too when I try to move it. And I'm going to look at this side, and so what I do is you don't have to help, and I can feel it fights me. And we've had toxin injections just a few months ago to
Right.
try to bring it down, and we injected some of the quadriceps muscles and we injected the hamstrings because those are the two muscles that control how your knee moves. And I'm getting quite a sweat here just working at it, and you have to do that. And the problem is with spasticity, it doesn't relax, and so you're fighting. It's like you're walking through mud all the time.
Yes.
And
Good description.
yeah, and so one of the things we can do is we can actually check your reflexes lying down, and we can get a better idea. Just let it go loose, let everything relax. And now we get a much easier, more obvious reflex. And why is that? Because we stretch all the muscles when you're lying down. And it's
Right.
the same as if you're standing. So this is a good way to compare for standing. And we can even sometimes, neurologists hit their hands instead of do that. When you get older, it hurts. But and we can see the reflexes. And usually the ones in the feet are less obvious. All right. So let me help you up here. We're going to have her walk in the hallway, and probably it's better to put your shoes on.
Sure.
And, man, yeah, just a little stiff on the right, and turn around and come back. Now I want you to do this for me. I want you to place one foot right in front of the other. That lets us see how well you balance. If you look straight ahead, your balance is much better than if you look down. Okay, yeah. All right. And you can do that. Very good.
Can.
Okay, just come back here. I want you to walk down the hall again. Just
Okay.
let your arms relax. Let your arms relax and walk down the hall. Yeah, that right leg tends to scissor a little bit. And do one more time, just with the gait. Beautiful, beautiful. All right, come on back.